Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Penicillin binding protein. First, we will see the normal points about penicillin binding protein. This penicillin binding protein is a normal protein which is present on the cell membrane of the bacteria. And this penicillin binding protein has transpeptide in nature. It is transpeptidase, that is, it breaks down two peptide bonds. So, penicillin binding protein is transpeptidase in nature, and this penicillin binding protein is required for cross linking of the peptidoglycans. For this cross linking of peptidoglycans, which is an essential step in the cell wall, for this we require penicillin binding proteins. So this penicillin binding proteins, to this penicillin binding proteins, these beta lactamase drugs will also bind, and thus they will kill the organism, or they will block the organism by binding or attaching to these penicillin binding proteins. But if there is an MRSA, but the second issue is there is MRSA. This MRSA, whenever there is methicillin resistant Staphylococcus aureus, here there is a gene mutation is seen, MEC-A gene. This MEC-A gene will result in alteration, or it will change the penicillin binding protein to penicillin binding protein 2A. This penicillin binding protein 2A will have less affinity to beta lactams. That means attachment of penicillin binding protein 2A to the beta lactam drugs is very less. So there is less affinity of penicillin binding protein 2A with beta lactam drugs is seen. Hence, methicillin resistant strains are resistant to all beta lactams. But in such cases, how are you going to treat the case? The treatment of this is, first you should give vancomycin is the drug of choice for methicillin resistant staphylococcal aureus. We can also use other drugs like teicoplanin, linezolid and streptogrammin are also given to the patients. Then we can also give drugs like ciprofloxacin or ribofloxacin, cotrimoxazole, clindamycin, mupirocin, minocycline can be given, and newer drugs like daptomycin, ceftobiprole, tigecycline and oritavancin can also be given to the patient.
thank you and thank you for watching.